Hello and welcome to the Hepatitis C ECHO program. My name is Desiree Rested and I'm the Training Development Manager with the Montana Public Health Training Center at the University of Montana, and I will be your facilitator today. This program is made possible by funding from the Hepatitis C, HIV, and STD program at the Montana Department of Public Health and Human Services, and we're so very glad that you're joining us today. I've gone through all of the instructions to sign in. Please make sure, at the end when we ask questions, feel free to come on camera and off mute to ask your question. Or if you're more comfortable, please just go ahead and put it in the chat. During the presentation, feel free to use the raise hand feature or just place your question in the chat, and Kayla and I will monitor that for Nicole. I am happy to introduce my hub team. We have Dr. Koo with us today. So Dr. Koo, will you please introduce yourself?
All right. Hello. Get that come off mute. So my name's Neil Koo. I'm an adult infectious disease trained physician, but primarily serve as the hospital epidemiologist at the Billings Clinic. And I'm the physician, planner and moderator for this program.
Yep. Without Dr. Koo, we don't do anything. And Kayla, will you please introduce yourself?
Yeah, thank you, Desiree. Kayla Chapongian. I'm with the training center as well, and I'm here to support with IT.
Excellent day. So today our presenter is Nicole Elinoff. Nicole is a senior manager at NASTAD's capacity building team. She develops and implements technical assistance and capacity building opportunities, supporting health departments and community-based organizations across the country. She leads the coordination of NASTAD's PrEP Access portfolio of work, working across many NASTAD teams, and works on many other topic areas, such as cluster detection and response. Nicole has experience in both the nonprofit and government sectors. Prior to NASTAD, Nicole worked as Regional HIV Prevention Coordinator for the Florida Department of Health in Orange County. She received her MPH in Health Education and Promotion from the University of South Florida and a BS in Psychology from the University of Central Florida. Nicole is based in Washington, D.C., and we welcome her to our ECHO.
Thank you so much, Desiree. Really appreciate the opportunity to be with you all, and love that we have a bit of an intimate group here today. And I know that we're at the HCV ECHO, but I was asked to talk a little bit about PrEP and PEP billing, and looking forward to talking a little bit about this really important this really important facet to implementation of PrEP and PEP. Just as a heads up, I will be speaking more about PrEP billing. And as another point of information, I did not develop, I coordinated the development of the PrEP and PEP and other HIV prevention services guide, which we'll talk a lot about today. But for deeper questions about billing, I might not be able to answer that, but we'll absolutely refer you to someone who could answer more deeper billing questions. So for those that don't know, NASTAD, we are an association of public health officials that administer HIV and viral hepatitis programs. We were founded in 1992, and our mission is to advance the health and dignity of people living with and impacted by HIV/AIDS, viral hepatitis, and intersecting epidemics by strengthening governmental public health and leveraging community partnerships. And our vision is a world committed to ending HIV/AIDS, viral hepatitis, and intersecting epidemics. So for our session today, I'll be doing a little bit of setting the stage to talk a little bit about some of the PrEP access landscape changes and some challenges that come up with billing for PrEP. I'll then talk a little bit about, I'll give a billing overview, share a little bit about additional resources, and then we'll have some discussion. And I'm sorry I'm not on camera today. My internet's a little glitchy and want to make sure everything works fine. So a quick quiz, if you can put it in the chat, why is billing and coding important to PrEP programs? So A, reimbursement for services, we got to pay the people. B, incorrect billing could lead to a big bill for patients. C, supports program sustainability, or D, all the above. D. Desiree, do you mind if we hold for 1 second? I have my computer plugged in to my other monitor, but for some reason it's not charging well. I'm gonna go into the other room and grab my other charger. I just see my battery diminishing as
Okay.
we are talking. I will be right back. I'm so sorry.
Oh, no worries.
I see a lot of people put D in the chat, and that is absolutely correct. All of the above. So for programs that have not necessarily started implementing billing for services, this could be a really great opportunity for not only like making sure that people with insurance are able to get PrEP without any money, so no $0 copay, but also like helping with sustained services and help if a program has a 340B covered entity, be able to generate savings that can then go towards helping those that might not have insurance be able to access PrEP and PEP services. Billing and coding, very important, and doing it correctly, very, very important. Before talking a little bit more about billing, just want to like further reiterate how billing for those that have insurance is just so important. This table is from a study that was done throughout 2018 and was published in Health Affairs in 2023. And it talks about the breakdown of the population of folks that are using PrEP and their insurance status. We see that a majority of individuals on PrEP have private insurance. With private insurance being the majority, billing insurance for services can not only ensure that patients don't have to pay for their PrEP, but also helps with sustaining the program. Just further setting the stage about some of the PrEP access changes and some billing challenges. In 2023, NASTAD updated its PrEP billing and coding guide to respond to many PrEP access changes that have taken place in the last several years. So some of these changes include the introduction and implementation of the United States Preventive Services Grade A recommendation for PrEP, which came out in 2019 and was fully implemented in 2021. But we still saw people getting charged copays for their PrEP services, which I'll talk more about in a bit. We also saw the FDA approval of both TAF-FTC, which is the brand name Descovy, and long-acting injectable cabotegravir, and that happened in 2019 and then 2021. We also had generic TDF-FTC come onto the market in 2020. And then 2021, there was the release of CDC's PrEP clinical guidelines. In 2024, CMS released their PrEP NCD, so National Coverage Determination. And then in 2025, almost a year ago, was the approval of the second long-acting injectable version of PrEP, lenacapavir. So some of the billing and coding challenges that have come up that this guide works to address. So many buckets of challenges that we were hearing from providers when it came to getting claims paid for so that people were not having to pay any copays. So labs, for many PrEP patients, they are doing their labs every 3 months. That is recommended. Every 3 months for their HIV test, for instance, for many health plans, the one HIV test will be covered without cost sharing as part of like the preventive services. But for PrEP, someone will need to have 4 labs done. With the 4 labs done like for the year, a health plan might have been paying for one of them, but missed that it was for PrEP for the others, and so someone was getting a bill. Prior to October 2023, there was no ICD-10 code for PrEP, so no diagnosis code. And so there's no right code for billing for PrEP. Luckily, there is a code and it has gone into effect, a couple years ago, and more plans are recognizing this new code in their plan policies. But for a while, that was a very big challenge, and not having a right code. Many programs don't have the capacity to manually check each claim to a health plan. Plans can be unclear when it comes to coverage and can be inconsistent. Billing could be coded incorrectly. There are some stigmatizing codes, which we'll talk about in a second, which one of them is listed here, and that's high-risk homosexual behavior. Modifier 33, which is really helpful with flagging if something's preventative, was not being adopted, and clients' employer plans were grandfathered, so they were not eligible for PrEP without cost sharing. So these were some of the challenges that come up when discussing PrEP and PEP billing for folks to be aware of. And would also be really interested in hearing from folks in the chat if they are currently billing for PrEP or if there's other challenges that have come up. So I want to just take a moment to highlight this resource, and that is the 2023 PrEP and PEP and other HIV prevention services strategies billing and coding guide. So this was released in October 2023. And we just released 2 additional supplements that address some other new developments when it comes to PrEP. But those supplements highly reference this 2023 guide. And for those that have not had a moment to, see it or are just learning about it, highly recommend referencing this guide for your PrEP and PEP and other HIV prevention services needs. I just put the link to that in the chat. So this guide overview, it goes into implementation of the U.S. Preventive Services Task Force Grade A recommendation for PrEP. So for those that don't know, PrEP has been given a Grade A recommendation, meaning that PrEP medication and PrEP services should be covered without any cost sharing for those that have a qualified health plan. So this is just really important to know that for those that have a qualified health plan, they should not be paying out of pocket for their PrEP services. The guide also talks about long-acting injectable PrEP implementation, as many programs are still working on getting that off the ground. Self-testing, PEP, troubleshooting claim denials, and other resources. As I mentioned earlier, there are supplemental guides that have been released, and that was in February, so like just last month, and that includes a supplemental guide for the CMS PrEP National Coverage Determination and lenacapavir for PrEP. And you can access those documents in the link that I put in the chat as well. So just some additional things to note about the guide that highlights different ICD-10 codes, and it goes into much more detail about that code that became in effect in October 2023. It highlights different HCPCS codes for PrEP, payer policies, and PrEP, PEP, and teleprep visits, modifiers, and denial and appeal tools. So here are some helpful codes for PrEP, and I also include some for PEP too. So for those that might not be fully versed in billing lingo, and I know for myself, this was a big learning curve about like what these different acronyms mean. So the combination of these different code types are used to describe the services that were provided during an encounter. So the codes are working in concert with each other. And if the codes are not congruent, then the services described in the claim might be denied, and want to make sure that you're using these codes correctly together. So CPT codes describe what was done. ICD-10 codes describe why the service was performed. Modifiers provide additional information not described by another CPT code. HCPC codes describe what supplies were used to complete the service, and POS codes, or like point of service codes, describe where the service was performed. So we're going to talk a little bit more about the ICD-10 code for PrEP. So Z29.81 is Encounter for HIV Pre-Exposure Prophylaxis. And it's just really exciting, again, that we have this code now, because for a long time it was just like playing billing bingo on what would be effective and what a health plan will pay for. So Z29.81, so this code does exclude the desensitization to allergens, so Z51.6, and prophylactic surgery Z40. And the code also notes, if applicable, risk factors for HIV, such as contact with suspected exposure to HIV, Z20.6. The code description specifically states PrEP. And we don't recommend the use of high-risk sexual behavior, Z72.5. So that's just a little bit more information about ICD-10 for PrEP Z29.81. So the guide also includes other ICD-10 codes that might come up for PrEP, but the Z29.81 is the one that is recommended for use. And again, it's not recommended or suggested to use the Z72.51 to 53 series. Or Z72.89, as those codes are stigmatizing and can show up on a patient's bill, and it's just not suggested practice. And now that we have Z29.81, there really isn't a reason to have to use these stigmatizing codes. And you all will get a PDF of these slides as well. And I also include like different page references of where more information about codes can be found easily. So for PEP ICD-10 codes, these are for post-exposure prophylaxis, and we have them here. So Z20.6, contact with and suspected exposure to HIV. Z20.2, contact with and suspected exposure to infections with a predominantly sexual mode of transmission, and so on. So these are some ICD-10 codes for so HCPC codes, or like Healthcare Common Procedure Coding System, are codes that CMS maintains and through its HCPC work group. And these codes typically describe non-physician services. They represent products, supplies, devices, services, and drugs, and biologicals. So when long-acting cabotegravir came onto the market, some HCPC codes were created for the administration of long-acting injectable cabotegravir. So J0739, injection of cabotegravir 1 milligram, and some further instructions on reporting the code with units. So if 600 milligrams of cabotegravir is administered, you would report J0739 with 600 units. And we also have codes for oral PrEP if purchased and billed by a physician office, and those are J0750 for TDF FTC, and then J0751 for TAF FTC. And then we also have some codes for lenacapavir for PrEP, which are J0738, and that code went into effect October 5th, 2025. And that is for 1 milligram of PrEP, so report 1 unit per milligram administered. And for oral lenacapavir, there is a code here as well for J0752. So those are just some, there are many other HCPC codes, and we have those on some of our different billing and coding guide resources. So when determining different like the counseling codes for time, there is a PrEP evaluation and management counseling decision tree. And so I'm just going to click through here. Was PrEP counseling the only service performed at the visit? If yes, you would use the preventive medicine counseling codes. And depending on the amount of time would determine which code from 99401 to 99404 someone would bill for. If no, was the site of the service the emergency department? If yes, you would bill these different emergency department services. And add a modifier 25, and I'll describe the modifier in the next slide. And so on. So like we have a couple of these decision trees in the guide, and they're helpful when determining, depending on what was going on with the visit. So we continue on with the tree, like was a problem-oriented evaluation and management service performed? Yes. Was it done at an office or other outpatient services in those codes? Or no, was an annual preventive exam performed? Because we know that sometimes PrEP might come up at someone's annual preventive exam and want to make sure that billing is done correctly. And so we have those codes here. So for PEP, PEP could happen in many different places. So we have these different locations listed in red. But wondering if was the site of the service a non-ED outpatient setting, which are listed here, and if yes, these are the codes for that. And if no, was the site service the emergency department, and then we have the emergency department services codes there. There are so many CPT codes when it comes to PrEP services because of the different labs that are involved for PrEP. I mentioned the 99401 series. So these are preventive medicine counseling codes. So there's like 15 minutes, 30 minutes, 45 minutes. And there's a full list of these codes on page 78 of the guide. We put the link in the chat, but I'll add it again just in case. So folks might be wondering about teleprep visits. So teleprep visits are telehealth visits for PrEP. And the counseling services rendered by a teleprep provider are the same as those administered when the services are face-to-face. It's really important to look and read payer policies on, what CPT codes are allowed for a virtual visit. Each policy might be different, and following payer policies is really, really important. Some other questions would be about what technology modifiers are required and what place of service codes are required. So for modifiers, we really talk a lot about number 25 and 33. So modifier 25 is significant, separately identifiable evaluation and management. So this would be reported with a visit code that is performed on the same day as another visit, like we mentioned in that decision tree a little bit ago. It would be reported with a visit code that is performed on the same day as a minor procedure, such as drug administration. And the documentation must clearly show significant and separately identifiable services. For modifier 33, these are for preventive services. So you'd report when the primary purpose of the service is the delivery of an evidence-based service in accordance to the USPSTF grade A or B rating. This is not, do not report for separately reported services specifically identified as preventive, and do not report if payer policy specifically rules out its use. So for instance, utilizing modifier 33 for like an HIV test isn't the first one in the year to also show like this is, for preventative purposes for PrEP. But it also should be used, well, the ICD-10 code for PrEP should be in place there as well. But modifier 33, really helpful to help flag that something is being done in accordance with USPSTF's grade A or B rating. So with payer policies, again, it's really, really important to reference these policies, but not all payers may have updated their PrEP medical policies in accordance with the most updated PrEP information. So it's good to keep checking things. For a while, lenacapavir wasn't necessarily included in discussions or in health plan policy information. So, because it's newer, it may take time to be included in payer policies. For like a lot of the major payers, definitely find, read, and understand the policies so that there's as much adherence as possible. And communicate with provider representatives with the payers. As another way to help get more information and clarity. So some resources for altering claim outcomes. We have a bunch of different appeal letter templates in the guide that I keep talking about. But let's say the claim was denied with no payment to the provider and no cost share to the patient. This commonly occurring denials are listed with corrective action. There's the appeal letter templates with rationale and supporting resources, and review payer policies before appealing a claim and understand the denial reasons. Let's say the claim was paid, but the payment amount or the patient cost share or deductible did not process as expected. Again, we have appeal letter templates with rationale and supporting resources. And NASDAQ also has a cost sharing complaint template that organizations can use as well. And also confirm that the plan is not a grandfathered plan. So this means that this plan was purchased before 2010. A lot of times this could be an employer-sponsored plan because individuals are not able to individually sign up for a plan that went into effect before, that doesn't follow ACA guidelines. But a lot of these grandfathered plans are employer-sponsored plans. So filing complaints, figuring out what kind of plan does the person have? Is it a qualified health plan? So they bought it through the marketplace or in the ACA regulated individual market. Is the group fully insured? Is it a self-insured or usually a large employer or a non-federal government plan? So figuring out which type of plan it is. And depending on that, where should you file a complaint? So can file it with the plan, benefits administrator, the employer human resources, State Department of Insurance, Department of Labor, or CMS, depending on the type of plan. And this is just a snapshot of the PrEP cost sharing complaint template that can be utilized and modified to help with issuing a cost sharing complaint. Wrapping up, this is a quick reference of the PrEP billing guide. We do have a comprehensive table of contents, but this is just a helpful quick look on where you can access different billing topics, the importance of those topics, and the beginning page section. And just some additional resources. Let's say your program doesn't have billing infrastructure yet. NCSD has a billing toolkit. While it is a little older, it could be helpful with establishing more of a foundation on ways to implement billing within your program. And then there's the billing and coding resources guide that I was talking about, and it houses the 2023 guide and the different supplements for NCD and lenacapavir. We have an upcoming webinar happening tomorrow, and that will be taking place with our billing and coding consultant, Caroline Poiker, who developed and wrote the 2023 guide as well as these supplements. She'll be going over the supplements in more detail. And we'll also be answering different prep questions. We'll also be having a billing and coding office hour, and the link for that is still in the works. But I will send that over to Desiree for her to send out with other items as a follow-up. So that's basically what I have just for our primer, but would be interested if folks had any questions. And I will do my best to answer.
I got a quick question, just
Yeah.
mostly for clarification here. I recently read that the funding for HIV treatments, and I'm assuming this will include PrEP, is for the Ryan White program is now as limited in certain states. So I just wasn't sure is that will the how if there's going to be any impact with that on billing. I'm assuming the answer is no because it's a separate fund, but it's always good to chance to clarify that.
Yeah, thank you, Dr. Koo. So I believe what you're referring to is some of the eligibility changes that some
Mhm.
states have put into effect regarding the AIDS Drug Assistance Program. And so the AIDS Drug Assistance Program is for individuals living with HIV. And so regarding the PrEP information today, none of the codes or things that I reviewed would necessarily be impacted by the changes going on with the AIDS Drug Assistance Program. Um, but we're NASAD is absolutely watching what's going on with state ADAPs closely, and also monitoring what's going on with what's going on changes to HIV prevention funding, and changes to the landscape.